Welcome to the GEMS Report, brought to you by Clarion Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. My name is Ted Lee, and I'm the editor-in-chief of GEMS. Along with Jeff Frankel, our managing editor, we will be bringing you industry leaders and experts in all topics on pre-hospital medicine. And today we have a very special guest. Ms. Shannon Popovich is the director of the Communication Center for REMSA. Thank you for joining me today.
Thank you for having me this morning.
So let's start off with a little bit of your background. Where you coming from? What kind of history have you had in this as we move into the topic?
So as you mentioned, I'm Shannon Popovich. I'm the REMSA Health Director of Regional Communication. I have a Juris Doctorate from Abraham Lincoln University, and I've been in the EMS public safety field since the late 1900s. I started out as an EMT, then I went into dispatch and absolutely fell in love with what dispatch does. I worked my way through the ranks as a call taker, dispatcher, supervisor, manager, administrator, and I'm the director of communications at REMSA Health. I've been a facilitator on a national committee that created national dispatch standards. In that, I volunteered to facilitate panels on the West Coast of subject matter experts. And then I sent my results from my panels to be aggregated with other panels that were facilitated across the country, and those results were put into national standards and then sent to ANSI, the American National Standard Institute, to be vetted and then signed into ANSI accredited national standards. So that's something I'm pretty proud of to have been a part of. I was a program manager for a couple of dispatch center implementations where we had an empty room and transformed that into a live functioning dispatch center. One of the things I'm really passionate about is promoting how vital dispatchers are to the emergency response system. Care starts with the call. And anyone who's ever taken a CPR class knows that the first link in the chain of survival is to activate the emergency response system. And that is dispatch. Not only do dispatchers take the calls and send the resources, they give the caller pre-arrival instructions to safeguard themselves or begin critical life-saving interventions like breathing assistance, bleeding control, CPR instructions, even instructions on how to deliver a baby as well as care for the baby and the mom after the birth. REMSA Health is innovative in its approaches to emergency services, and we have a different sort of formation on how emergency response works here in Washoe County. So we have a franchise agreement that is good for over 30 years, and then we continue looking at it, see if we want to extend it out. But the way that we provide emergency service is a little bit different because REMSA Health is a nonprofit organization that provides emergency medical services to the community at no cost to the taxpayers. So the fire department doesn't have to staff ambulances and provide compensation for paramedics. We do that to the community free of charge. REMSA is also innovative with a clinical team, on-site education facility, and that serves the entire region. And we have highly trained paramedics that perform state-of-the-art emergency care to the community. Our dispatch center is EMD, EFD, and ECNS Emergency Communication Nurse System accredited. And we just want to do the best for our community.
Wow. Well, congratulations on all of your work, and thank you for the work that you put in. It's kind of unique because usually it goes the other way where somebody gets into EMS and stays in EMS and runs from dispatch or telecommunication, but you ran toward it. So kudos to you. That's great.
Thank you.
You threw out a lot of acronyms and a whole lot of stuff there, and let's try to pull that apart a little bit. And one of the unique things about REMSA, from what I understand, is that you are triple accredited, and that was part of the acronyms that you mentioned. So if you would talk a little bit more about each of those accreditations.
Yeah, so we have EMD, which is Emergency Medical Dispatcher, and that accreditation ensures that our dispatchers who take medical calls for service understand the ins and outs of medical calls that would come in and what types of pre-arrival instructions, meaning directions on bleeding control or directions on how to perform CPR. We give those instructions to the callers so that they can begin care at the time of the call and they don't have to wait for paramedics to arrive. EFD is Emergency Fire Dispatcher, and that also gives an in-depth training for fire dispatching, which includes what fires are, how they work, different types of fires, fire rescues, how to handle car accidents, and how to give instructions to callers in those fire-related situations prior to the fire department arriving on scene. It helps us to ask questions that are pertinent to each type of call that comes in. ECNS is Emergency Communication Nurse Systems, and you must be an accredited EMD center to have an established ECNS, Emergency Nurse Communication System. And what that does is that allows us to transfer our lower acuity calls over to nurses in our nurse health line, and they can further evaluate the patient at a nurse level and determine if there is a better route to assistance for them, for the caller. So let's say somebody has a lower acuity complaint that they're calling 911 for, like constipation, or the catheter has been dislodged. Those are not necessarily calls that we want to send emergency responders to. We want to save the emergency responders for the critical heart attacks and things like that. So we're able to transfer those lower acuity calls without priority symptoms to the nurses to evaluate and try to find a better source of care for them. We can send them some type of transportation. We can give them tips on self-care. We can get them to an urgent care as opposed to an emergency room. So it keeps unnecessary patients out of the emergency room and keeps us from responding and keeping the responders available for those higher priority calls.
So are all three of these accrediting or accreditations through a single accrediting body, or is it through multiple?
So it's all through a single accrediting body. The International Academy of Emergency Dispatch is who we are accredited through. It's an international academy because it's an organization that has medical directors, police and fire experts around the world that are consistently evaluating emergency responses, and they determine the best dispatch response procedures. And being a accredited center in all of those areas, we have access to all of that international information from all of those experts. And then they implement that into protocols, and then we establish those protocols here in our center, and we train to those to make sure that we have best practices for our community.
So, I mean, a lot of people that are listening and that will run across this have had some interaction with some type of accreditation, whether it be law enforcement or EMS or fire or educational or something like that. But could you speak a little bit on why accreditation of a telecommunication center or communication center is so important?
So being an accredited center ensures that we have continued efficiency, consistency, and excellence. And not only do we obtain that accreditation once, we have to keep it. So we have to send the Academy monthly quality assurance reports. We have to show them that we are still meeting the standards that are required for that accreditation. And every 3 years, we're reevaluated to make sure that overall we're meeting the standards for accreditation. Being an accredited center is similar to like a plastic surgeon, right? Would you rather go to a plastic surgeon at an accredited institution with board certified plastic surgeons, or would, it's just a better level of care. It's higher level of education and experience that you have to be accredited.
So you mentioned a little bit about like monthly reports and then every 3-year cycle. Again, most of us have had some type of interaction with accrediting bodies before. Could you go a little bit more into, the rigor of, or, what is the process of becoming accredited? Because now you've done it 3 times, and, once is brutal enough, but, to do it 3 times is, almost crazy.
Yeah. So it takes about 6 months to a year for the whole process. Because you're working back and forth with the Academy you're sending in information, you get progress reports, you get feedback, critiques, and then we have to sort of tweak some of our policies and things like that to make sure that they are up to their standard. So there's a 20-point assessment, there's a 20-point assessment involved, which includes how our center is set up, the technology that we use, how it's managed, our training programs, policies within the procedure. We have to have a dispatch review committee that has a medical director, management, quality assurance personnel, clinical staff, fire department oversight representation, and we have to show our notes from that to make sure that that committee is actually doing its job and reviewing dispatch in a way that makes sure that our performance is at its highest level. The performance that we are already doing prior to accreditation is evaluated to ensure that we are correctly taking calls for service and providing those pre-arrival instructions to callers before responders arrive. We also have to agree to share our performance data so that there's nothing hidden. We are showing you all of the work that we're doing and how we're doing. We have to agree to support the Academy's Code of Ethics and standards. I mean, it's a pretty intense process that you go through where they evaluate almost everything that you do to make sure that you're providing the highest level of service to the community.
Right. Well, as you know, JCO for hospitals and you know, accreditation of ambulance services usually do. They pick and go through everything. So it is always quite a daunting process. So
yeah,
go ahead.
And with each one of those, there's separate accreditation processes. So just because we have all three of them from the same institution, we still have to send 3 different evaluations, and they monitor us on those 3 different levels. So you know, it's a lot of work to keep all 3 of them up.
Yeah, well, I can imagine. So so with that, you know, why don't you get into a little bit about, you know, who's your team, who works there, you know, what are you guys doing? Obviously, of course, you're a telecommunication system and you do fire, EMS, and you know, subacute, but you know, tell us a little bit more about who works there and what you guys are doing for your community.
So our community of dispatchers, we have the franchise agreement, like I said, with the county, and they have certain stipulations to that agreement for us. And our dispatchers have to be at minimum medically trained as EMD. Every person that works in the center must have a minimum competency of an EMT, emergency medical technician. There's a rigorous academy that they attend to make sure that they understand how to take the calls for service, what kinds of calls for service are typical to our community. And then with having the EMD accreditation, they must be certified in EMD and EFD, emergency medical dispatch and emergency fire dispatch. And so there are academies and certification programs that they go through there. And then when they come back here, they have a whole nother academy that goes over the types of calls that we receive here and how to handle them. The benefit of having the EMD and EFD certifications is our dispatchers get exposed to calls for service that might not be typical for this area. And in case any of those types of calls ever came up, they would know how to handle it. We also dispatch for the Truckee Meadow Fire Protection District, which covers a large area of Washoe County where we're located. We also have partnerships with other fire departments in this area to dispatch certain resources for different types of calls for service. So our dispatchers are highly trained and competent in serving the needs of the community.
So what's the area of coverage in the contracts that you have? About how large square miles do you think your telecommunicators cover?
You know, I don't know what the square mileage is, but it's a very diverse location. We have just under 500,000 for our population, but included in Washoe County is Reno, Nevada, the tourist biggest little city. It's a destination location. So just because we say that our population is just under 5,000, obviously we have more patrons that we support. We have events that occur throughout this area. We have rural areas, we have densely populated areas, And because of those rural areas, REMSA also has Care Flight, which is air medical EMS. We have 4 helicopters and 1 fixed wing. So our dispatchers have even a higher level of expertise because you have to know what resources to send to what area. Do we need to call in the helicopters? Can we send an ambulance? And we have 4-season weather. Sometimes there's extreme heat, sometimes there's snow, there's different terrain. And so our dispatchers are always thinking about what's ahead when they're dispatching.
Yeah, for a population of that size plus a tourist population that changes over probably weekly, what would you say your typical call volume is for a month?
We process, meaning inbound and outbound calls, about 500 to 600 calls per day. That's calls that are coming in on 911 or non-emergency lines, calling back other PSABs, requesting other resources. So about 500 to 600 calls a day is what we average here.
You mentioned a little bit about the unique area. What other challenges do you guys see, in the dispatch center on a day-to-day basis?
I mean, just with the different types of topography we have here, you really have to know the area where the call is coming from. So is this a rural area? Is it something that's going to need a 4x4 unit that goes to it? Is it something that's going to be okay to have a type 1 resource, that can drive on the street? With the wildland fires, that we have a lot of rural area out here, a lot of dry area, mountains. The wind, we have a different type of wind pattern here in the Sierra Nevadas. So those types of things affect the way that we take calls and the way that we send resources. And that's just extra training and experience that our dispatchers have to navigate on a day-to-day basis when determining what types of resources they're going to send to what calls. And it makes a big difference because if you send the wrong resource to something, it's going to take longer to get there. And I say this to people all the time, is seconds save lives, and it starts in dispatch.
Yes. How many telecommunicators do you have daily?
We have different types of positions. So we typically like to have at minimum 7 911 personnel, and then we have 2 Care Flight, which is the air medical dispatchers, and then we have 2 non-emergency call takers. So at minimum about 11 to 13 people per day we like to have per shift, not per day.
Right. So that's quite a group that you have every day, with a unique environment for sure. So why was accreditation so important to you guys to get? Because not everybody gets it. Not everybody would want to put themselves through it, not once, but 3 times. So, why is it so important for you in your jurisdictions?
To us, the EMD, the EFD, and the ECNS accreditation are important, not only for pride and accomplishment and to have plaques, but it's to ensure that we have highly trained and competent dispatchers that are ready to provide excellent care, ensuring that we have the most up-to-date training and we're providing best practices for the community. It makes us accountable to our customers with our professionalism. We have to have continued quality assurance, and that monitors our work product. And I mean, it's not only to verify that we're doing the work to the standard of the accreditation, but it's to keep finding areas to improve. And with that, it allows us to come up with different ways to be progressive and provide care to the community that is sending the right resource at the right time.
Well, as you mentioned earlier, the chain of survival that everybody knows starts with, activation and recognition of the event. And, telecommunicators and dispatchers play a very critical role in getting that information out and getting the right resources, like you said, to the right place, and supporting the people. So thank you for everything that you do. Again, it was very nice meeting you and great having you here. So we've got a couple more minutes. Any other messaging that you would like to get out about REMSA and the Emergency Communication Center and what you guys are doing?
Yeah, I think maybe the last question we can add a little bit more to that about what it means to us is, we want to process calls efficiently. We want to provide the best care to patients. We want to stop the spread of fires as quickly as possible. And being accredited allows us to be that efficient. It ensures that our best practices, dispatch protocols are implemented. It provides us international recognition that we are doing what we are supposed to be doing for the community. It allows us to use the nurses as an alternative to 911. And, like I said, seconds save lives, and dispatchers are crucial in saving those seconds. And having the highly trained dispatchers that we have, providing the necessary information to responders so that they know what resources they need to take into these calls, it ensures that we are continuing to be excellent.
Well, again, it was great talking with you. Very interesting story about you guys and your accreditation journey for sure. Thank you for all the work that you do. And again, if there is anything that we can do for you, or if you'd like to come back and talk again, we'd be very welcoming.
Thank you so much. Have a great day.
You too.